Hi, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes. And I just wanted to talk to you quickly about um, the relationship of teeth and tick-borne illness. And I know I've talked to you about this before, but I just got off of um, a GLA meeting, and they had a super cool biological dentist in New York, and he was talking about the role that dentition plays in maintaining a level of chronic inflammation, which obviously makes Lyme worse, and Bartonella, and all the other ones. And so, one of the things that I thought it was really interesting, because there seems to be some debate over whether or not tick-borne illness actually causes dental issues, or if the dental issues result from, poor hygiene or poor diet or genetics or things like that. And then Lyme comes in when you get infected, and then Lyme goes to where you're weak. So you're genetically weak in the dentition when you haven't done X, Y, and Z to maintain your dental hygiene or whatever. I thought it was really interesting because my intuition tells me that it is more of an opportunistic situation going on with the um, uh, tick-borne illness causing cavitations and cavities and periodontal disease and cracked teeth and all these things. And the dentist, he agreed that he felt like it was opportunistic. And so I guess what I want to say to everybody is, and I know I'm speaking to the choir, but you need to maintain really good dental hygiene um, throughout your life, but particularly when you're fighting Lyme disease, because these bacteria are opportunistic and they will go to where you are weak. And if you aren't maintaining proper dental hygiene, you're going to have a weakness there. Plaque's going to build up. It'll be a nice, cushy biofilm. The organisms will be like, oh, yeah, let's have a party there. No, you don't want that. So, the importance of dentition and maintaining good dental hygiene is of paramount importance. Drinking plenty of water with electrolytes in it is also important. Substitute for that is coconut water. You can get it online, or you can get it at Trader Joe's for cheap. It's called Zico, Z-I-C-O, and that will help to maintain your electrolyte balance in your body. The other thing is maintaining your oral microbiome, which gets absolutely slammed by antibiotics. And so you can do some oral biome probiotics. And there's one I think it's called Oral Biome at Research Nutritionals, that's specifically designed for maintaining the oral microbiome of the mouth to maintain its health. And the other thing that can get derailed when you have tick-borne illness is you can get dry mouth. And I know all about this because I have this. And so one of the things that I do to help me with keeping my oral microbiome healthy is I use these things called ACT dry mouth lozenges. And they're made of xylitol, so you don't really have to worry about sugars. And the other thing that I use is called Xylamelt. I don't know if you can see it. Xylamelt. Xylamelt will also help you with dry mouth. And dry mouth can occur from the infections itself, but it can also be the result of chronic antibiotic use. So I use both of these products all the time. And the Xylamelt you can actually put in your mouth when you sleep, because sleep is also a time when you get really dry mouth. And I have that problem quite a bit. So these big lozenges, the ACT, these are too big. You can't use them at night. But the Xylomel, they're much smaller and they're softer. Let me show you what they look like. They look like this, and they just kind of melt and dissolve. So they're a good thing to use at night to help with the dry mouth. So I hope that you have found this information helpful, and I hope you have a wonderful day. Take care.